All right, you are now live.
Right, thanks, Elizabeth. So just to confirm, we have quorum. So quorum for this committee is six, and we have six, and we've got a couple of delayed committee members who will hopefully be able to join us shortly, but we can get underway now. Yes, Elizabeth?
Yep, we have quorum and you can go ahead.
Okay, so I'd like to call this meeting to order, noting that the time is 4:32. And I would also like to acknowledge that Halifax Regional Municipality is located in Mi'kma'ki, the ancestral and traditional lands of the Mi'kmaq people. The municipality acknowledges the peace and friendship treaties signed in this territory and recognizes that we are all treaty people. We're just going to go through a roll call. So if you hear your name, just put your hand up or say here. So I'm here. Hannah is joining us late. Councillor Lovelace will be joining us late. Cheryl, I think
Here.
last name Cheryl. Both Cheryls is here. Great. Liz is here. Hi, Liz. And Rhiannon is here.
Hi.
Hi, Rhiannon. And Doreen is here.
Hi.
Thanks, Doreen. We have regrets from Councillor Becky Kent and from Zoe and from Sonia. But let's also acknowledge our support staff. So Amy is here, I believe. I'm not seeing Amy. Amy is here.
Amy hasn't joined the meeting yet.
Right. Bailey is here. Hi, Bailey. Carla is here. And Elizabeth is here. So if we could please move on to item number 2, which is approval of the minutes from July the 4th. I'd ask that the question, are there any errors or omissions to the July 4th minutes? Hearing none, could we have a motion to approve the minutes? I need a mover and a seconder on this, please.
I'll move to approve because I love to rhyme.
Thanks, Liz. So moved by Liz and seconded by
I'll second it.
Doreen.
Doreen.
Doreen, okay,
Yeah.
thank you. There was a few hands that went up fast and furious. Thank you, Cheryl and Rhiannon. So I will acknowledge that the minutes of July the 4th have been approved as circulated. So thank you everyone on that. So everyone in favor. We got a show of hands. Everybody's good. That's a peace sign, Doreen. I like that. That's great. Thank you. Thank you very much. So that has been, the motion is carried, the minutes have been accepted. So if we can move on to item number 3, approval of the order of business and approval of additions and deletions. Elizabeth, I'd like to ask if there are any additions or deletions from the clerk's office.
There are no additions or deletions from the clerk's office.
Thank you, Elizabeth. Can we have a call for a motion to approve the order of business? This requires a mover and seconder. So could I please have a mover and a seconder? So that was Cheryl was the mover. And who was seconding that? Rhiannon. Thank you, Rhiannon. Appreciate that. So the agenda has been approved as presented. Thank you. All those in favor, please raise your hand or say aye. Okay, any nays in the pile? Take that as a no. Okay, great. So the motion is carried as presented. So thank you for that. Item number 4, we are looking at business arising out of the minutes. There is no business arising out of the minutes. Is that correct, Elizabeth?
That is correct.
Thank you. I'd like to move on then to item number 5, call for declaration of conflicts of interest. I'd like to know if there are any committee members that have any conflicts of interest that they would like to declare as a result of the agenda as approved. None. Okay. Thank you. So we have no conflicts of interest. Thank you very much. Item number 6, consideration of deferred business. There is no deferred business. Is that correct, Elizabeth?
Correct.
Thank you. Moving on to item number 7, correspondence, petitions, and delegations, 7.1. If I could ask you, Elizabeth, if there is any correspondence that was received by the clerk's office.
No correspondence has been received by the clerk's office and no petitions have been received by the clerk's office.
Thank you. 7.3, presentations. There are no presentations. Is that correct, Elizabeth?
Correct.
Thank you. And if we can move on to item number 8, information items brought forward. It's my understanding that there are none. Is that correct? Yes, thank you. And then if we can please move on to item number 9, reports and discussion. This is an HRM. The first is 9.1.1, HRM's approach to harm reduction. And we have Max Chauvin with us. So Max is going to be giving us a presentation on housing and homelessness. I'm going to turn the floor over to you, Max, and your colleague, Alicia Buchanan from housing. Alicia's housing coordinator. So I'm going to stop talking and mute myself and turn it over to you for your presentation. I'm going to mute myself, but I would like to acknowledge that Hannah is here and Hannah is our vice chair. Thanks, Hannah, for joining.
So Alyssa, I have promoted you to co-host so you can share your slides.
Perfect. Thank you so much. I'm just gonna do that
So,
now.
Chair, thank you very much for inviting us to come and speak today. As mentioned, Alyssa Buchanan from our office is here. So I am the Director of Housing and Homelessness for the municipality. Alyssa is our housing coordinator. So she is responsible for the work that we do specifically around facilities, shelters, temporary housing, on a variety of projects. She also brings to the municipality a large wealth of experience, having worked in Shelter Nova Scotia facilities such as Turning Point and facilities such as the Diamond Bailey House with the Big Monday to Friendship Center and a variety of other things. So this is she certainly is our subject matter expert. And so what we've put together is a bit of an overview on harm reduction. I'm going to get Alyssa to walk through this and give you the information. We've tried to focus on a bit broader around harm reduction than strictly the homelessness crisis. And we've tried to talk about things that are specific around HRM's approach in our work, but also the approach within the municipality around this space. So I'm going to turn it over to Alyssa to take us through the presentation. We're both happy to answer questions as they go forward, and we're also happy to, if there's more information you want around a topic, or you want to speak to some folks in other perspectives, anything like that, we are happy to facilitate. And you can certainly request that through the chair. Also, Elizabeth knows where we all live, so it's very easy for her to come and knock on the door. So with that, I'm going to turn this over to Alyssa and have her walk us through the presentation.
Perfect. Can everyone see my slides? I just want to confirm. Sorry, I can't see you folks while I have the slides up. So if anyone can give me a verbal.
Yes.
Okay, thank you.
They're
Sorry.
beautiful. We love them.
Okay, thank you. I just want to make sure I don't want to start talking and then lose that. So it's a hefty presentation for a brief overview on harm reduction, but we'll go through it. A bit of an agenda to give you an idea of the flow today. We'll start with talking about what harm reduction actually is, the principles of harm reduction, some focus on harm reduction and substance use disorder, some misconceptions and benefits, and some specific pieces around women and harm reduction, and some connections to other approaches. And then we wanted to do some focus on where we see good harm reduction practices in our community, within HRM and also the sector, and as well as where we're seeing harm reduction practices that need some development in both the sector as well as HRM. And we'll finish off with some recommendations for improvements and, of course, lots of room for questions. So start today by talking about what harm reduction is. We should know what we're talking about. So simply put, harm reduction are strategies and practices designed to lessen the negative social and or physical consequences associated with various human behaviors. When speaking about harm reduction, a lot of
Alyssa,
the... Oh, yes. Is it not going?
your slides aren't moving.
Oh, heavens. Let me just see.
There we go. So one more.
Now
There
are
we are.
seeing?
Now we're
Okay,
caught
all
up.
right. See, I knew I'd have some sort of little technical difficulty, but we got it done early. So when we're speaking of harm reduction, the focus generally on working with individuals who are using drugs. But I really want to focus today of understanding that we all engage with various types of harm reduction strategies and practices every single day of our lives. So let's talk about some examples. So some examples of harm reduction. I engaged in harm reduction today by putting my seatbelt on and driving the speed limit. I also wear sunscreen. We engage in different ways, and it's important to note while there are strategies and practices designed to lessen the negative social and physical consequences of risky behavior. Driving is inherently a risky behavior. We also have individuals who don't always follow that. I'm sure everybody in this room digitally has probably gone over speed limits sometime of our life. So while we have socially accepted parameters, we all have times where we go outside of those as well. So some principles of harm reduction to speak of. First would be respect. There's a commitment to human rights and treating individuals with dignity and respect. There is accepting that drug use is a part of our world or harmful behaviors in general, and choosing to work towards minimizing the harmful effects rather than simply ignoring or condemning them. It's also an understanding that behavioral change occurs incrementally. Small gains for many people have a much bigger benefit to our community rather than large heroic gains achieved for a select few. People are much more likely to take multiple tiny steps rather than one or two giant steps. Empowering individuals as the primary driving force responsible for reducing the harms related to the harmful behavior that they may engage in or behavior that has potentially harmful outcomes. Compassion is working from a non-judgmental approach that meets people where they're at and an understanding that every life is valuable and that behaviors that people engage in that could have potentially harmful outcomes are complex and challenging. And finally, it's working with people collaboratively to create quality of life improvements that matter to them. So you can see I'm already leaning into it a little bit. We'll talk a bit more about harm reduction and substance use disorder. So substance use disorder is the persistent use of drugs despite the substantial harm and adverse consequences that they have on one's own self and others as a direct result of that use. Harm reduction seeks to reduce health and social harms involved with addictions and substance use without necessarily requiring people to abstain or stop their use. Substance use is tied to risky behaviors, which could be needle sharing, unprotected sex, and use in general contributes to a weakening of the human immune system, which puts individuals with substance use disorder at a greater risk for a multitude of health consequences. So I thought it would be useful to talk about some misconceptions of harm reduction, as there are a lot that usually follow this discussion. The first is that harm reduction programs and services enable illicit drug use. Harm reduction, very much again, accepts that some people are going to engage with behaviors that have potential risks, which include drug use. It inherently acknowledges the very real harms associated with risky behavior and creates strategies to mitigate that instead of ignoring that they are happening. Another one that I hear a lot is that harm reduction prevents or even directly opposes recovery methods or approaches. Harm reduction's main goal is to keep people alive and safe as safe as possible. Harm reduction programs have actually been shown to be a gateway for addictions treatment programs. Really interesting study out of Insight, which is Vancouver's first and North America's first safe consumption site, which opened in 2003. So we have 21 years of evidence from that. Study that they completed there, 23% of people who access services through that site actually stopped injecting, and another 57% entered addiction treatment programs, many whom had not entered before because they didn't have that non-judgmental approach. Another misconception is that we see an increase in substance use in surrounding communities. Out of that same study for Insight in Vancouver, there was actually 71% reported fewer public injections and 56% reported less unsafe needle disposals. And finally, the misconception that we will see an increase in crime in surrounding communities. Studies across the world, across Canada, the US, Europe, have around programs and services that offer harm reduction have found zero evidence of harm reduction services increasing crime in surrounding areas. More interestingly, corner stores and adding corner stores to community can actually have a higher rate of bringing crime into community. So speaking of some of the misconceptions, we can speak of now some of the benefits. There is a cost benefit. Each overdose that's managed at a safe consumption site, for example, produces approximately $1,600 Canadian in cost savings, which would have from the impact that would be on the healthcare system, with an overall savings of about $2.3 million a year for the life, $2.3 million for the lifetime of the program, rather. Generally speaking, by providing safe disposal of injection equipment, harm reduction programs reduce improper syringe disposal, which reduces the number of contaminated syringes circulating in community, protecting from accidental needle sticks. As we mentioned before, we see an actual increase in treatment, referrals, and initiation. Overdose prevention, many lives are saved through supervised consumption sites, for example, or through providing with safe testing, so folks can test their drugs before taking to make sure that they are not contaminated or toxic. And there's just the overall community safety piece. Instead of having people hide in the shadows, we have people who are able to engage with support and combat shame and stigma. So I wanted to spend a moment to specifically talk about the intersections of women and harm reduction. So while stigma can impact all individuals who use substances, women's social location creates additional expectations around behavior, roles, responsibilities, creating additional sources of shame and judgment. Women have unique experiences related to drug use, which can include violence, the experiences around pregnancy and parenting, and some income security and housing. Feedback from community partners have highlighted that the impact of overdose crisis on women, that there's an importance for a gender inclusive harm reduction approach. So some specific examples of what that can look like in terms of the unique experiences women might experience around substance use is there's a lot of stigma around substance use, which deters pregnant women and mothers from accessing health-related and social services for fear of being judged, treated poorly, and most primarily losing custody of their children. Women who use drugs are more likely than their male counterparts to experience sexual violence and other forms of violence. Additionally, women who have experienced violence, I found this interesting, are more often prescribed prescription drugs with additive potentials for longer than recommended periods, and then find minimal support for tapering off these drugs and accessing other forms of support. So sometimes the violence came first and the addiction came from trying to treat that violence. Women engaged in sex work face significant harms, such as the risk of HIV, experiencing discrimination, criminalization, and violence. A study in Vancouver found that people engaged in, or women engaged in sex work at the street level were actually deterred from accessing health, social, and syringe exchange services because of their need to avoid the physical environments where those services were located, where they would be exposed to violence and policing. Criminalization, women who are criminalized are the most likely to be incarcerated for property crimes such as shoplifting, theft, and robbery, which are many times related to poverty and substance use. And homelessness, which are teens' experiences. Often women experiencing homelessness are not visible in ways similar to men. They are often underhoused versus sleeping rough in a tent, staying in unsafe situations a lot of the time. Women experiencing homelessness are at a high risk for victimization and violence, including sexualized violence and domestic violence. So harm reduction measures would also need to be around that. And connection to other approaches. We really briefly wanted to touch on how harm reduction overlaps and touches base on a number of other approaches that we try to use in our work as well as throughout the sector. Housing First involves quickly and successfully moving individuals experiencing homelessness into permanent housing without preconditions or barriers to entry like sobriety, treatment, or service participation, which is very based in a harm reduction model. Trauma Informed understands considers the pervasive nature of trauma and focus on promoting environments of healing and recovery rather than practices and service that may inadvertently re-traumatize, which is inherently a harm reduction approach. And I wanted to note person-centered language is really built out of that respect portion of harm reduction, using language that puts people first rather than disease, symptom, or condition that they may have. So again, referring to individuals with substance use disorder rather than identifying somebody as an addict. The person comes first and the condition that they are experiencing is after. So some examples of good harm reduction practices we are seeing in the sector. I could spend the entire time just speaking on this. There are a number of amazing programs. I will touch base on a few. I could have filled this page with the tiniest of fonts and name many, many more, especially outside of the lens of addictions and substance use disorder. So a few I'll highlight are Mainline Needle Exchange, which provide needles, syringes, cookers, condoms, and other clean supplies for individuals. They also provide safe disposal of used needles, sharp containers, and they do outreach for the removal of needles in the community. They provide test strips for fentanyl, and they provide navigation of peer support. Direction 180 provides a number of services, including opioid agonist treatment options, such as methadone, which has a huge reduction in risk of death and hospitalization for people who inject their drugs, specifically opiates. They also have a recovery support program and overdose prevention training. Refix Overdose Prevention Site is the first overdose prevention site in Atlantic Canada, operating under an exemption to the Controlled Drugs and Substance Act. And it is been going for a couple of years now and is done in partnership between Friendship Center and Direction 180. North End Community Health Center has a managed alcohol problem, which provides a safe supply of alcohol prescribed by a physician for a group of community members with severe alcohol use disorder. We have the Substance User Network of Atlantic Region. They are an official partner with the St. John Ambulance National Drug Alert System, so they can actually submit drug warnings to be added to that database to allow people to know of tainted drug supplies. And the ability of naloxone at pharmacies has been a huge, huge benefit towards good harm reduction practices. As of June 30th of this year, 3,420 kits, naloxone kits, have been distributed by the pharmacy. Naloxone is a injection or nasal spray that you can give to temporarily stop opioid overdose. And then finally, I wanted to note the Harm Reduction and Housing Community of Practice. This is actually a small new group that myself and one of my colleagues are a part of, bringing together those providing or supporting harm reduction-based housing throughout Nova Scotia, sharing experiences, knowledges, and practice approaches to try to improve the experience of those who are providing and accessing services. So a few good examples of harm reduction in HRM would be, we had in 2019, Regional Council unanimously endorsed HRM's participation in the development of a municipal drug strategy, which is in the process. The public safety strategy, current public safety strategy, number 6 particularly is focused on reducing harms associated with alcohol and drug use. And the entire safety strategy is in fact a harm reduction measure. Our housing and homelessness team, specifically our housing and homelessness coordinators who provide outreach. They are 2 social workers who engage with individuals staying in designated and non-designated encampments, providing navigation to resources, supports. We have our Business Improvement District Navigator Street Outreach program. They provide direct support to individuals who are unhoused and precariously housed in the urban core. We have our community mobilization team, which support the response and recovery from the experiences of a traumatic event and work towards preventing violence by reducing distress, restoring unity, and building resilience through the community. And we also have Safe Cities and Safe Public Spaces program, focusing on preventing and addressing sexual and other forms of gender-based violence in public spaces throughout HRM. Program is focused on promoting girls, women, and non-binary people's right to use public spaces free from intimidation, sexual, and all other forms of gender-based violence. And of note, overall work throughout the municipality, sidewalk and road maintenance, fire and public safety education, community wellness programs, emergency preparedness, inspection and code enforcement. All of these are forms of harm reduction practices. So where do we see room for development within the sector? We have our Hours of the Overdose Prevention site that I previously mentioned. It only operates 6 days a week. It operates Monday to Saturday, not open on Sunday, and it is only open from 9:30 a.m. to 2:30 p.m. So the hours are not the most accessible for everyone, which is a limiting factor for its overall success. We have no wet shelter. So a wet shelter accepts people who are under the influence of drugs or alcohol and also offers a supervised space for people to use or consume them. Some people sleep outside because they've been banned from shelter use or for using drugs or alcohol or for the behaviors that come with it. So we do have folks who are at a higher risk of harm by being unsheltered outside because they have no space to be in. We have lack of access to detox and rehab. Since the onset of COVID-19, Nova Scotia has seen some closures of 24/7 detox beds, and there's been a shortage of clinical therapists in certain areas. Some people are waiting weeks or months to get into inpatient treatment. Treatment lasts 7 days, and then you're discharged, often without supports. And for some individuals, that could look like being discharged back into homelessness. There also is unnecessary triaging of needs, which generally involves seeing those with alcohol use disorder prioritized because there are unique risks of detoxing off of alcohol. It is the only substance you can detox out and die due to withdrawal symptoms. So because of that, necessarily, folks are prioritized. However, that results in folks with other forms of addiction having to wait longer and potentially missing an opportunity. And finally, lack of training for staff. Overall, there's a lack of training for staff within the sector. There's also a large turnover rate within the sector and limited funding for training. We also have a lack of after-hour responses and supports. Largely, the after-hour responses and supports look like having to engage emergency services, which might not always be the appropriate response. Within HRM, where we see harm reduction practices that could use development, would be education and training opportunities around harm reduction, mental health, and crisis interventions for employees throughout the sector. Training opportunities have started. I have actually been able to engage in some of the pilots of those, but they are focused on those in programs most connected to the areas. There definitely needs to be a rising capacity to be able to expand these wider to all staff, regardless of where you work in HRM. Appropriate responses for individuals requiring assistance. Often we have people calling police for non-criminal issues as there's just no other alternatives. So we have police responding to matters which are not a police matter, which would be best resolved by having another person on site, perhaps a mental health professional, could be a variety of things, but are responding because there's no one else. And I also wanted to note, responding to calls to justice from the National Inquiry into Missing and Murdered Indigenous Women and Girls. Additionally, also need additional education around residential schools, colonialism, and intergenerational trauma. Can certainly see some needs for development in those areas. So, where are recommendations for improvement? These are just a few that we have picked out. Would be reviewing HRM's existing programs, practices, and spaces with our harm reduction lens. And I would also add potentially having a gendered harm reduction lens as well. Creating and delivering harm reduction training programs for employees as well as the general public. The continued development of a municipal drug strategy, including harm reduction approaches, establishing a stabilization center, which is in the works, establishing a mobile citizen-led response outreach team, and advocating for the province to prioritize programming, sheltering, and housing options with harm reduction principles built within them. That takes us to the end for questions and anything anyone has there.
Wow, thanks, Elisa. That was quite you covered quite a lot of territory in a relatively short period of time. Thank you for that. It was a brilliant presentation. So we have a speakers list, if that's okay with you. We'll work through the speakers list and then we'll loop back for other comments that people might have. Max, did you want to add anything at this point, or are you good?
No, I think Alyssa did a great job covering sort of some of the key stuff that we see in our work, and happy to answer questions from members of the committee.
Perfect. Thanks, Max. Okay, so Hannah, you are first on our speakers list. So over to you for any questions you might have.
Cool. Well, thank you very much for coming and sharing all of that with us. I appreciate it greatly. I don't have anything off the bat, but I will reach out if in 2 to 3 days after I've processed it all, something comes up.
Okay, thank you, Hannah. Councillor Lovelace, over to you for any questions that you might have.
Thank you, Madam Chair. Sorry about that. I was on my phone and now I've just switched over to my laptop. So I think you can hear me okay, right? Is that correct?
Yep. Yes.
Okay, great. So thanks for the presentation. You know, this is extremely important topic that the public really needs to hear. So I'm glad that we're having this conversation here, Max. And, you know, one of the things that I continue to struggle with as a rural, suburban councillor is that I don't have access in my communities to a lot of these resources. And yet the need is just as great in that families in particular in these areas, because they are so disenfranchised and distant, and the services are inaccessible, that being able to ensure that community organizations, community groups, access to information at libraries, we don't have the healthcare centers, we don't have the doctors, we don't have the mobile mental health team here. We don't have all these things. And so I feel like, while I sincerely appreciate the presentation, I just feel like it's very urban centric because we're looking at communities that are on the outside and cannot access these services. So I do know that when we're thinking about the schools in the rural and suburban areas in particular, those schools need access to this information. Teachers need to be trained on harm reduction, administrators at schools and so on. So even our community recreation facilities, they're not run by HRM. They're run by nonprofit community groups that, don't have easy access to some of these resources. So I do think that we need a bit of a deeper dive into how we can strategize to ensure that we have a much more equitable delivery of some of these services, and at the very least, some of this information. But I sincerely appreciate the work that you're doing, as always. And thank you, Alyssa, for the presentation.
Thank you, Councillor Lovelace. I don't know if Alicia or Max, if you wanted to respond to what you've just heard, or if we can continue going through our speakers list.
I just think what Councillor Lovelace brings forward in terms of the lack of services in rural components of the municipality don't just live within this space. It's in terms of housing support. It's in terms of poverty reduction and so on. It's even in terms in some of the community building activities and opportunities that are there. So it's certainly an issue, and a lot of the health resources and so on are all concentrated in urban. And so one of the offshoots of that is, because there's nothing in some areas of HRM, the situation for some can get worse because there is simply nothing that they are able to access. And again, the councillor has lots of examples of that that she can share. And we could get similar examples from councillors that represent Eastern Shore, Musquodoboit, and so on. So it's certainly something, I think, that's bigger than this as well in terms of an issue, but it does have deep impact here.
Thanks, Max. Alicia, did you want to add to that?
Yeah, I would just add that I think an important perspective as we think of harm reduction quite widely some of those services that are prevention, that are community wellness based, that are healthcare based. Those are also forms of harm reduction in a preventative one. So there's definitely a need for not just the reactionary elements, but the preventative pieces as well. So thank you for sharing that, Councillor Lovelace. Appreciate it.
Great, thank you. So we'll move on to Cheryl Kopaj. Over to you for any questions that you might have.
Sure. Thank you for the presentation. I'm going to kind of build a little bit off of what Pam was saying as well too, because a number of our Indigenous communities, we do, the presentation was great, but it was a bit urban centric, and a lot of our First Nations communities are located outside of the urban core area. I'm glad to see that we are partnering with the Friendship Center, but I think there's opportunities for us to build a better relationship with our Indigenous communities that are located within HRM. Just for example, I know that Sipekne'katik has a very interesting program called the Post Majority Program, where they're doing really preventative work with children that are aging out of the child welfare system. And a lot previous to this program, we were experiencing a lot of these children going into homeless or couch surfing situations. But now we have this program in place where we're able to provide support for these young people to find shelters or find places to home, and supports for them to get the skill sets that they need to address homelessness and other harm reduction issues. One of the other things I would like to really continue to stress is the importance of addressing the MMIW calls to action. There's like 213, and only 2 of them have really been addressed in the 4 or 5 years since the report is coming out. So there needs to be a concentrated effort to ensure that we're doing more to make sure that our Indigenous women are safe and continue to provide support and services for them. But with that, thank you guys for all the work that you're doing. Really is appreciated.
Thank you very much, Cheryl. Again, Max or Alyssa, any comments in response to what you've heard?
I'd say thank you so much for sharing that. I worked with the Mi'kmaq Native Friendship Center for about 4 years, and throughout I worked with, when I left, I had 108 families I was working with on my caseload, and the needs are many and the supports are few. I had folks who were within the urban core, but I also had folks who, Sipekne'katik, I also had folks who went back and forth between various communities throughout Cape Breton, as well as out of province. I had a number of families who were disconnected from their home community, and the needs are many, many. I worked with children's principal for 3 of the years I was at the Friendship Center, so a lot of those youth-based programs and a special need for youth transitioning out of care, knowing that there's a gross overrepresentation of Indigenous youth within that population, is a huge area of concern.
Thank you.
Thanks for that.
I think the other thing in this vein that comes from Cheryl's comments is that we're very aware that homelessness and these issues present quite differently in Indigenous community. They present different in the Black community, and so on. And one of the things that we talk a lot about is a one style, one approach, one prescriptive piece to address the problem doesn't work. And so we really struggle, quite frankly, provincially, with the fact that we need multiple service providers that use different approaches, and that should never be taken to be negative to one particular service provider or their approach. Because in every case I run into these, I can go meet with people who will tell me this approach is the best. I love it. It saved my life. But then I'll go talk to somebody who says, this doesn't work for me. I'm excluded. It doesn't support my beliefs. There's a list of things. And so in interest of efficiency, quite often the attempt is to come up with one solution to address everything. And that universally leaves people out that don't get any help. And that's a continuous battle that we have as we work with partners, work with the province on the importance, and could certainly give you some more detailed examples if people want that.
Thanks, Max. I'm going to continue on the speakers list and move over to Liz, please. Over to you for any questions you might have.
Thanks.
Thanks for the presentation. It was very comprehensive. I'm now going to make a series of fussy comments and ask some questions. My apologies. So I was really pleased to see you highlight the importance of a housing first approach in your presentation. And I feel quite curious about why Halifax doesn't have a housing first approach anywhere. So I'm an outreach clinician by trade. One of the things that works really well about harm reduction is that it sends people the message that they are valuable no matter what choices they make. People who use substances because they are in pain. Sometimes they're in physical pain, sometimes they're in emotional pain. They are treating their pain with substances, which is actually a very sensible thing to do if you think about it. And when people are in tremendous emotional pain, when they're living with the impacts of trauma, personal or generational, when we can come to them and say, hey, you know what? I would love it if you used fewer opioids because I feel worried about you, but no matter what choices you make, I'm going to keep coming back and I'm going to keep trying to help you however I can. It sends them the message, okay, I'm really valuable. So maybe that can help diminish some of the pain that they feel. And that makes it easier for them to stop having to medicate so much. A housing first approach works in large part. I mean, there's all kinds of practical ways where a housing first approach works, right? Like it's just easier if you have a safe home base to do all of the practical things that you need to do to stop using substances. But also it sends the message like, you know what, even when you're using substances and even when we see the behaviors that often come along with substance use because you're not well regulated, we still think you're valuable and we still think you're deserving of a home. And we are sending the opposite message. We invested enormous amounts of time, effort, public infrastructure, and money to make a shelter that treated people who use substances as well as other unhoused people with tremendous disrespect. And that sends the exact opposite message. There is a lot of conversation in the municipality about, oh, this is a provincial responsibility, this is a provincial responsibility, but this was something that was not only within our orbit, but it was something we were working on, like something that we operationalized ourselves, and we made that decision. And I feel worried in part that one of the reasons that we do it is because I apologize if this sounds critical, but I think it is possible that HRM doesn't actually have a harm reduction lens. They have a risk reduction lens. So a lot of the examples that you used, and first of all, actually, I love the slide where you were like, actually, we all do harm reduction all the time, because I think that is actually true. We do harm reduction all the time. But I also don't think that any of those were examples of harm reduction. They were examples of risk reduction. Putting on a seatbelt is not a harm reduction activity because driving a car is not inherently harmful to you unless you get into a car crash. The seatbelt is there to protect you in the event of something bad happening, not to diminish the harm that's happening to you now. Harm reduction is that we don't have leaded gasoline anymore. The harm that your car does by driving is to the whole planet, and it does it with pollution and emission of carbon, but it doesn't also now add lead to the atmosphere. Unleaded gasoline is harm reduction. And I feel worried that part of what stops us from doing things like housing first or from spending money in ways that actually meets people where they're at and actually could have a real significant impact on their health is that we are thinking about risk reduction instead of harm reduction. Risk reduction seeks to avoid any harm. Harm reduction accepts that harm is inevitable. And it is true that a lot of harm reduction practices continue some measure of harm to the people who use them, but also to communities. Look, I worked very closely with supervised consumption sites when I was working in Ontario. And like, it is true when you have a supervised consumption site in your neighborhood, like there is harm to that neighborhood. People who use supervised consumption sites don't go quietly to the supervised consumption site, then consume their substances and then like go away. There is noise, there is undesirable behavior, there's all kinds of stuff for super understandable reasons. And we feel lots of compassion for everybody who's involved in that. But it's true that there is harm. And I feel worried that the municipality is actually not comfortable with accepting some degree of harm to everybody in a community in order to prevent greater harm and to take steps towards really reducing harm. So I want to know, my question is, what is our official position and why we don't have a housing first approach in HRM? And I also want to plant the seed that maybe if we really want to get serious about harm reduction, we have to come to a place where the municipality is comfortable accepting a certain degree of harm and we're not taking a risk reduction approach. Thank you for tolerating my fussiness.
Thanks, Liz.
Oh, I don't consider that's fussy at all. So a couple of things and sort of where you're going. Part of the reason that we don't have a harm reduction approach within the municipality is that we don't, some of our partners and some of the folks, other levels of government don't believe in it. And so the municipality has advocated multiple times for the need for a wet shelter. We have advocated for single room occupancy shelters and a variety of other things, and we have been unable to convince the province to do any of them. And so that is one of the big challenges. And quite frankly, we do not follow the funding requirements of the federal funding that comes in. So it comes in, it has requirements for prioritizing those at highest risk and at highest need, and the province doesn't do that with their facilities and with what they bring on. So that, I think, is the core reason. I believe you are quite correct. In every discussion, there is a discussion about risk. But I think the municipality does advocate for some higher risk activities, such as safe consumption site and those kind of pieces. Some of those, which, as you probably know, are controlled federally. We can't set them up. We have to go to the federal government. But provincially, our health department will not support that ask, which is challenging. That said, yes, there are more things we can do. Lisa mentioned her presentation about that we need to take a harm reduction and a harm reduction gendered lens to some of the things that we still don't do as much as we should. But quite frankly, at the core of this is the service provision on the ground, other than some outreach work that we do, is all done provincially.
Great, thanks, Max, for that. I'm going to go back to our speakers list and invite Rhiannon to ask a question.
Hi, everyone. Alyssa, nice to see you.
Nice to see you.
Thank you very much for your presentation. I was wondering, one of the slides was talking about some of the approaches that the HRM does have, or some of the programs. What would be kind of the difference between the housing and homeless coordinators and the business improvement districts outreach program? Is that just like, well, actually, because what's the difference between those?
So there are a variety of outreach groups within the municipality. Shelter Nova Scotia has a group of them. Welcome Housing. The HRM itself has several, and the business improvement districts, they have 3 outreach staff, one that works in Dartmouth, one that works in North End Halifax, one that works in Halifax downtown and Spring Garden Road. They all have a outreach mandate. They all provide similar type services, but the ones that are in the bids can focus on the specific needs of that community, which is sometimes different depending on what's in the community and what's going on. They also are connected to that business improvement district, so they're aware of the needs of businesses and residents in that district, separate necessarily from what else is happening. I don't know if that answered your question, Brianna.
I think so, yeah. It's just like business improvement. It's an interesting title, I guess, in thinking about how we treat people who are unhoused, if it's like related to that.
It really isn't related to that. They operate quite independently from the business development, but what it is those agencies have deep connection with the residents and the businesses in the community. And so what it gives them is a outreach worker who is deeply intimate with that specific region, Whereas you'd find the Shelter Nova Scotia folks, our folks, deal with folks everywhere.
Okay, thanks, Max. I'm gonna move us on to our next person on the speakers list. That's Cheryl Murphy. Over to you for your question, if you have one.
Hello, Alyssa, great presentation. Lots of good information, lots of good learning for me at least. I guess my question kind of is kind of in the Rhiannon's place as well as you have all these groups working within the municipality, whether they be sector or whether they be government, right? And I'm wondering what level of collaboration there is, and if the collaboration helps to make overall effectiveness or overall better outcomes.
Great question, Cheryl. Maybe we'll take it from two levels. I'll let Alyssa talk about sort of what's on the ground, very much there. We work with our provincial colleagues on a daily basis, and we talk with service providers. At this point, we have 2 meetings a week with all of them, Tuesdays and Friday mornings. It has made an enormous difference, as what it allows us to do is have a conversation about resources. So, for example, the Forum Shelter would share with everybody, we have 5 beds today. Somebody else would say, I've got 1 bed that's good for this. We had a service provider yesterday morning share, in a couple of weeks, I have an apartment coming up that we support, good for a single mother and children. And so now outreach workers heard that directly. They know who has it, they know who to call, and they can get a referral in and do that. So that is certainly does really well. I think secondly, we have good connections on the ground, and maybe I'll let Alyssa, because she's part of some of those chats and stuff, just tell you a little bit about that.
Yeah, certainly. One of the great things about the city is that it is a small sector. So within HRM, one of the benefits that we have is myself and our housing and homelessness coordinators, my colleagues, we all have, I think we counted between us 33 years of combined experience in the housing and homelessness sector, specifically within HRM. We have a lot of connections to the nonprofit communities, both the shelters as well as outreach teams. My colleagues have regular, small, very frontline oriented conversations with outreach workers on a regular basis to talk about both with consent of clients, obviously doing some case conferencing around folks who have specific difficult needs, as well as kind of some overall practice elements to make sure that we are operating in a way that's productive. We share our schedules with each other to make sure that folks know, okay, on Wednesday is when Shelter Nova Scotia is visiting the Green Road encampment. And we also know that, okay, we look across these, nobody's kind of checking in on Tuesday. Do we need to kind of make adjustments there so that we are having sustained, engaging conversations with individuals, because the work that we do is inherently based on relationship. And we can't just come in and say, we have all these solutions, because that's not how it works. So it's really important that we have sustained ongoing conversations, building trust, and finding out what people's needs are so that we can actually either navigate to the existing resources that are there or advocate for the resources that are needed because we don't have them in our communities. There is also, within the housing and homelessness spectrum, there is a coordinated access system for Halifax. With COVID, as with a lot of things, that had kind of taken a bit of a backseat. There had been a lot of less in person. Those pieces are picking up a bit more. So folks within that organization, nonprofit or community-based organizations that offer supportive transitional housing but have housing options are encouraged to engage with that process. So when the spot is available, there is the by name list of folks experiencing homelessness in HRM. They would go to that list and pull the individuals that meet. So let's say it's from an organization that serves women. They would not be screening in individuals experiencing homelessness who are men, but they would pull names of women there. So the real crux of what that coordinated access system is, it doesn't matter whose doorstep you show up on. It doesn't matter if you got into Barry House or Metro Turning Point or involved with an outreach worker and you're not staying in a shelter. If you engaged in that system, you have the same opportunities and remove some of that unintentional bias from relationships that we have with people and to create those opportunities throughout individuals. And there is, I'm very happy, the housing and harm reduction community of practice. It's very much in its infancy. It has just started, but it is involving individuals working within the provincial public health system, as well as frontline workers and myself and my colleague are taking a part from municipality lens. So again, continuing these conversations, sharing what we're seeing and where the needs are, and being able to pass those recommendations to make sure that there's advocacy for what is missing.
Great, thanks, Alyssa. We're gonna move on to Doreen. You're next on our speakers list. Please go ahead, Doreen.
Thank you. Cheryl, I think we were sharing a brain cell there because you stole my question. But it's such an important one that I'd like to ask it just with a little bit of a twist, and preface it with a couple of lenses that I don't know if are missing or not, because it probably part of the present, it would have been nice to know who you're partnering with as part of that presentation. So it gives us a little bit of a context. And when I say partner, I mean, yes, there are different levels of government. Many of us around the table and all of these groups understand that there are limitations because of the different responsibilities and some of the protectiveness that comes around working with that. I worked for Max and Alyssa's just for your knowledge, I worked with the provincial government. I also worked in schools as a high school principal. So I can understand how there are things can be interpreted differently, and people kind of are protective over their domain and what they control and what can happen. But I really appreciate that you're bringing these partners, because I believe it's at the municipal level that you're able to bring all of these partners together under the umbrella of trying to tackle this issue around harm reduction. And you've got all of these other areas that you're working through, and I really appreciate that. But it would be really good for us to know who those partners are, and not just provincial governments, but who in the community are we working with? There are some, Councillor Lovelace talked about some harder to reach areas. A couple of others come to mind, and that for me would be taking a look at our disenfranchised youth. So those that aren't connected to schools, those youth that are, and I'm talking about and I'm going to put our gendered lens on that too, specifically our young women that are disenfranchised and not connected to some of our more traditional structures, but might be connected through other groups like the Y or some other kinds of groups. So how are we reaching out to really try to capture some of our most vulnerable in our youth? And I'm looking at it from a youth lens in that perspective. Another perspective I would really be curious about is from some of our, we're living in a much more visibly multicultural population now. So what are we doing for our newcomers? There's a lot, I would say, a vacuum there as well. You know, how are we reaching out and providing supports for those that don't even know how to access what is already almost inaccessible? So taking a look at it from a linguistic or a culturally responsive lens as well. Again, I'm not sure if that's being looked at. It just wasn't reflected. And I know you can't reflect everything in a presentation. So I really appreciate that. Just, I'm curious from a couple of those other lenses, how from a harm reduction, like how we're looking at harm reduction to get to some of these other vulnerable sectors of our population.
Great, thanks, Doreen. Max or Alicia, either of you want to chime in with that? An answer to that or response to what you've heard?
I mean, Doreen, I think a great question. I think, you know, there should be huge kudos to the province here on their work at bringing people together into rooms. They're very active in that and do a good job. I mean, they're the ones who are having this group meeting twice a week and so on. I think in terms of youth, we're connected with the Y, we're connected with Phoenix, with Homebridge. We also are starting to work more with Posse, that you may be familiar with. Very, very, very positive initial conversations with them. We also are connected with ISANS. And so we've had conversations with Jennifer when she was as the ED there, and talk to her about how do we get people connected. And we also work with Chebucto Connections and some of those community organizations that come forward. And quite frankly, the other very common one, and I won't, Councillor Lovelace is certainly an example of this, but also local MLAs, they also reach out. So we do have people who, I mean, the other day, somebody showed up in one of our urban MLA's office looking for help, and the MLA called us and connected us, and then we went forward. So we try and be as connected as we can be to as many possibilities, so that if you show up in somebody's doorstep and you say, hey, I need some help, that you get connected around the team. Because no outreach gets everybody. And again, I come back to a comment earlier. There are times when we think that if we just build one system, the right system, we'll get to everybody, and we never, ever, ever, ever will. We need different pieces, different approaches, different places to work on that with. So I think that's important. And Alyssa may have a couple of other thoughts as well.
Yeah, from an on the ground level, I would say we are both seeing that and having regular engagement. Like, I can think of examples of my colleagues working with newcomer women. One of my colleagues actually recently advocated to prevent and successfully supported this person with a number of other community partners to prevent someone from being deported. So we're seeing real situations of harm and real situations of vulnerability for folks who have additional barriers to accessing services as well. Again, I would just highlight that a big part of that is maintaining those connections and those relationships. It's really important that we, from our team and from municipality, try to be supportive to all of our community partners, because we know we need to work together towards the same goals, and we want them to think to reach out to us and to be able for us to reach out to them when we are collaboratively working together to support someone. So we certainly are seeing, in terms of youth, in terms of newcomers, in terms of our Indigenous communities, both within community as well as those who are displaced into urban areas, seeing those needs upon needs and those social locations making folks more vulnerable or having unique experiences and barriers that others may or may not be facing.
Great, thank you very much for that. I just wanted to say again, thank you for the amazing presentation. It was a lot of material to cover, and it was all exceptionally clear. So thank you for that. I just wanted to go back to the role of SGBA Plus. So we know that the federal government has a requirement to use SGBA Plus since 1995. And so that should be informing policy decisions, programming decisions, etc. So I'm just foregrounding my comment in, why are we not utilizing SGBA Plus as an analytic lens to look at what's happening with harm reduction in HRM. And so to echo some of what we've already heard, Liz in particular, Housing First, if we actually use sort of a GBA Plus lens to understand who is at greatest risk and who remains sort of invisible in the housing sector. You know, why are we not looking at that through a gendered lens to ensure that that plus, which represents the intersecting axes of oppression experienced by populations that might lead to homelessness, so that can be addictions, mental health, it can be language issues, it can be a whole variety of issues. I'm just curious what your thoughts are on why we don't sort of foreground our conversations about harm reduction and housing in particular through the SGBA plus lens. Thanks.
I think some of the discussions are guided by that. I mean, the recent move forward to create the YWCA space on Barrington Street for women and gender diverse individuals. I think the continued discussion you see in shelter pieces about creating women's spaces and things like that. I think you see some of that. And I think you see, I mean, I'm perhaps a little flippant in some of my comments about housing first. I don't think it is that we don't use any of the principles of housing first. I just think we don't use them all as we go forward. But I think there is discussions. I think the Y is a huge advocate. I think ADSUM, if you take some of you probably follow Sherry Lecker and ADSUM's pieces, that is a continued piece they bring forward into every discussion. As we look at, I mean, if you watch their stuff, they will note the number of families and women that call every day, how many spaces they have and things like that. And even on our Tuesday and Friday calls that we have with service providers, there is discussion about these are specifically spaces for women, with families, with children, and so on. So I think there is some of that in the discussion.
Okay, thanks, Max. I had a question about the National Housing Strategy and the two key priorities, as I know you both know, is reducing homelessness and increasing housing affordability. And I'm just wondering what the metrics are that are being used to determine whether or not we've met one or both of those in HRM.
Oh, that's. I guess there's a couple of answers to that. One is we traditionally, for affordability, use the CMHC definitions. The challenge with the CMHC definitions is 30% or 20% below current market value is still not affordable for the majority of people who are looking for affordability. So I think we need to talk about the amount of deeply affordable housing that is, how much geared to income housing is available. And so I think we struggle a lot in the sector when we talk about metrics, that I am not sure that the metrics we use necessarily mean what we think they mean. And so I think that is a challenge. And I would challenge in many cases when we hear things on the news that say it will be affordable. Yes, it will be affordable as per a nationally agreed definition, but it's not necessarily affordable to the people who need affordability.
Yeah, great. Thanks, Max, for that. So thank you. We're at the end of our speakers list for this item, but are there any additional comments or questions from the committee that you would like to share? Or if Max or Liz, you have other comments? Yep, Liz, I see your hand is up. Please go ahead.
I just have a quick clarification question. This one won't be fussy. I just want to make sure I really understand sort of this barrier piece, because in hearing both of you talk, both of you, Alyssa and Max, like it's clear that we're coming at this from the same philosophical standpoint. And I want to get a really good I want a little insider baseball. I want a really good insider's view of what is it a funding barrier? Is the issue that the province hates, harm reduction, and so there's going to be no cash available? Like, what is the actual barrier to adopting a housing first homelessness strategy in HRM?
I don't think the province hates any of it. I think when I'm asked about it, I've often used the term, we do housing first light. Because there is this piece of, there is a clear goal, get people off the street, begin moving forward. The challenge comes, I think, at sort of what you've described in earlier comments, which, by the way, were not difficult or anything. So I'm not going to let you label yourself. But I think there's lots of things that come with that. And I don't think it's one answer. I certainly don't think it's the province hating anybody, but I think it's a capacity issue. There's a funding issue. There is, I quite frankly, and I've said this publicly, I don't believe funding, I don't believe space and so on are the biggest barriers that we're struggling with. I believe sector capacity is the biggest barrier that we face. I think we've talked a little bit about substance abuse. Alyssa touched on it in her presentation, but I know people, and Alyssa, I suspect, knows people who have said, if you could get me into rehab, like, so a long-term supported program, not detox, but if you could get me into rehab tomorrow, Max, I would go. And I've had that multiple times. I'll let Alyssa speak to her experience. Our challenge is there is nowhere to send you.
Yeah.
And so now you begin the cascade of, like, so for example, you talk about people who may not want to go into a shelter. Well, some of the reason they don't want to go into the shelter is there is no place for them they can see themselves going. Like, you should not live in a shelter for a year. You should not live in a shelter for 2 years. You should move into a shelter off the street, maybe into something even beyond that if you're ready. But if not, let's get you in a shelter, stabilized, food, give you some time to decompress, and then be ready to transfer you to the next piece. Well, there are people who are sleeping rough right now, who are stuck in, I see no path forward for me, so I don't go. So I think it is complex in terms of the reason why, but I don't think anybody is hateful of it or doesn't or wants to leave somebody behind. But maybe Alyssa could. Sorry, go ahead.
Sorry,
Liz.
just before you. I like you so much, and I've just met you, but I really don't like that answer. Is the thing, because, and I appreciate the artistry behind it, but like, here's the thing. Is if there's nobody who goes into a pleasant place and says, well, I can't see getting out of here, so I don't want to go to this place that is meeting my needs. Do you know what I'm saying? Like, it's that it's the failings in the intermediate step, and part of it is that, yeah, like, if you are going to a shelter where you cannot consume alcohol and you're going to get the DTs, that's no bueno. Or if you are, if you're not worried about dying of withdrawal, but like opioid withdrawal is also, I'm told, very uncomfortable, and people will go to great lengths to avoid it. So, like, for me, it's I find it just based in my own experience, which I acknowledge, of course, is limited, and you may have had other encounters that give you that different perspective, but it doesn't pass the sniff test for me that people aren't going into shelters that work for them because they can't see what's going to work for them next. For me, if somebody is sleeping rough, which is also a very undesired situation, rather than going into a shelter, it's because a shelter doesn't meet their needs. And if we don't have a barrier in terms of funding, is the issue insufficient infrastructure, like not enough trained staff to support people in a shelter that allows consumption? Like, I'm just really trying to understand what the barrier is, because I do think it is a substantial barrier in terms of addressing the homelessness issue, because a lot of people who aren't using substances before they become homeless begin to use substances because it is quite unpleasant to be sleeping rough every night. So I really am, I am sort of kicking the tires on this one, and I really do want to play a challenge function here, because I really want to understand, like, why don't we take a real housing first approach? And I think this one is a quibble, and I will own that, and you can't take that away from me, Max. I don't think you can have housing first light, because housing first is an absolute stance. Housing first is no matter what else, we will house you. And so I think you can't put a but on that. I just don't think it works.
Fair point.
So fair enough. I think I'll challenge one of your pieces coming forward is, I think to think that there is a barrier doesn't work. I think if
I'm
we
with
are
you. You're right.
if we try and say, what is the single problem that prevents this, we will never come to the answer, because there is a funding issue. There is a service provider issue. There is infrastructure issues. There's all of those things. There are, as I think Alyssa said in her presentation, we do not have a wet shelter space. That is a mixture. One of the things that Housing First requires is a prescribing clinician.
Okay.
We are unable to get that level of service. So that,
and is that
makes it-
regulatory, or is that just person power?
Well, that's an assignment of a prescribing clinician from health.
Okay. Okay.
That is
See,
not
that's super
available.
helpful. That's super helpful.
That's not available.
So Max, I'm gonna, just for the sake of time, I'm sorry, I see Cheryl
Sorry.
put her hand up for quite a while, so I'm gonna just ask Cheryl to please unmute herself and ask the question that she has.
Well, I don't really have a question. Kind of have a and Max, you talked about it. You talked about that it's more than one barrier. I mean, it's a cultural barrier as well. I mean, we have not cared for our homeless until the last 10 years. And let's be honest about that. Most people have not cared about their homeless. Liz's face just tells me she doesn't like that response. But I mean, I think that the prominence of homelessness has, and the, let me say this, that I think that there has been a lot of blame against the individuals themselves. They wouldn't be homeless if they didn't have it, if they weren't drug addicted, or if they hadn't done this, or they hadn't done this, or they hadn't done this, right? They wouldn't be homeless. So I think you have to change that culture. And I don't, I worked around government long enough to know that changing people's minds, both politicians and the public, takes a long time. So it's a culture, it's a funding, it's an infrastructure, it's a staffing, it's all of those barriers. But I was kind of, Alyssa, I was kind of happy when you said that you were meeting with, your first level health folks, your ground level health folks, with kind of that housing first idea. So that to me says that inroads are being made.
Thanks, Cheryl. Alyssa, did you want to respond to that? And then we're going to have to wrap things up.
I'll keep it brief. I have buried the lead. I was a housing first intensive case manager for 3 years. So I have very much seen what it can look like in practice. The beauties of small successes to working with a client. I don't maintain relationships with clients, former clients, because I respect appropriate boundaries. But I had run into a former client of mine not too long ago, and his goal was sobriety, and he has maintained that. But that was a goal that he determined for himself. Other folks are alive, and that is my win. I am happy for that. I will say, I think Max really highlighted it's a capacity issue, and capacity being a very broad spectrum of a capacity of funding, a capacity of, I myself have oversaw the operations of a transitional housing program. It is a sector that has a lot of burnout and a lot of turnover. It is considered entry level for a lot of people. So there is the loss of knowledge as you continue to have folks go through. And I think most importantly, it's an overall cultural shift of perspective, very much what you had highlighted in terms of the blame that goes on to individuals. From a gendered lens, I find that also worth noting of often that comes from psychologically from a self-protection mechanism. We see a lot that with some women's approaches to sexualized violence. Historically, we had a lot of people of, well, I wouldn't be there, I wouldn't do that. That is inappropriate and victim blaming, but it is coming from a place of, if I can do these things, it wouldn't happen to me. Because I think, especially with COVID, a lot of us are realizing how close we are to some of these experiences. So it's really not a fun, easy, quick answer, but it really needs to be that paradigm shift of perspective of moving away from individual blame and more of, where are we seeing systemic needs and some of the contributing factors that are going into people's experiences, and how do we support people?
I think one more thing that's important to touch on in Cheryl's question is there is a growing impatience with people who are experiencing homelessness,
yes,
and growing violence against people who are experiencing homelessness. And we are seeing examples across North America of increasing violence against persons experiencing homelessness. And that's another piece in terms of Cheryl's question, that we are actually going in the wrong direction. Not
Thanks,
we
Matt.
as HRM or this group, but as a society, we're going in the wrong direction.
Thanks, Max. So I see, Doreen, you've got your hand up, and then after that, for the sake of time, we're going to wrap up this and move on to the other parts of our agenda. So over to you, Doreen.
I really appreciate this deep conversation and deeper dive we're taking into homelessness. I fear that we're equating harm reduction with homelessness, and that if we resolve homelessness, we're going to resolve any need for harm reduction. So, I mean, I know it's a loaded statement, but I'm just putting that out there, that that as an individual, but also a member of this committee, I think it's important to do that deep dive and understanding that resolving because we can't resolve all homelessness, but resolving our issues around that is critically important to this. I really want to see our focus. I would like to see our focus expand beyond that. I mean, we just need to take a look at my middle-class neighbors down the street. We need help, right? So it's how are we ensuring, and Max, you talked about this, like we just can't have one lens, one answer. So I just needed to put that out there. I really appreciate the deep dive, and I think we need to do that, but I don't want to equate the need for harm reduction with homelessness only. I really want us to stay with a larger, I would like to see the group, at least not this group, your group, stick with that larger lens.
Great. Thanks very much, Doreen. So I would like to thank our presenters. Thank you, Max and Lisa, for being here. Appreciate your sage advice and the information you've shared with us. I do think the sex and gender-based analysis plus component part, at least for this committee, is kind of the focus of our mandate. And so I think it's important to keep that in mind when we think about issues of harm reduction and obviously housing instability and housing precarity. So thank you very much to both of you for your time. Really appreciate it. We hope to have you back again at some point in the near future. But for now, thank you very much.
Thank you for having us, and we are happy to come back at any time. And Liz, if you want to find a coffee and go to town on a couple of these issues, would absolutely love to do that. And Elizabeth or Councillor Lovelace or Hannah all know where I live and can give you my contact info.
It's a risky offer, Max, because I'm going to take you up on it.
I am well aware of the riskiness of the offer, but I'm happy to do it. I won't speak for Alyssa, but pretty sure she'd be keen to come too.
Well, thank you. I appreciate you both very much. I appreciate all the knowledge you shared today.
Thank you again for your time. Take care and bye for now.
Thank you so much.
Okay, just give folks a second to jump off the line. Okay, great. So we're moving on then to item 9.1.2, update on staff report regarding Administrative Order 2019-004 Gov, respecting the Women's Advisory Committee and the Halifax Regional Municipality. And I'd like to invite Carla and Bailey to provide an update on this item, please, and thank you.
So I was initially going to tell you where we were in the process, but the process is kind of over now. So I'm not really sure what happens next. I don't know if Bailey can speak to that part.
Yeah, I got this. So this Monday, the report went to Executive Standing Committee. The next step is for it to be sent to Halifax Regional Council. Elizabeth, I'm not sure of the date, but it was passed to Executive Standing Committee, the update to the terms and reference and the name. I also wanted to touch on today, I know that like people had sort of been asking about why do things take so much time when we're getting reports. It is so much more than just like Carla, who sadly had to make do without me, just writing a report and being like, okay, done, hope council likes it. So after your motion went to the initial one, went to Executive Standing Committee and the motion went for us to write a report, it had to be sent to us. So even if we wrote it all up and finished this, we didn't receive like the in process thing until late July, more or less. And that's not often the case, but in this case it was, which is a shame. And that's just the first thing. Then you have to write a report if you haven't already been writing it, if it is late. After you write your report, it needs to go to your business unit manager, and then it needs to go to legal sometimes, and then it needs to come back to you. You need to revise it. It needs to go back out to internal and external and legal review. And then it needs to be approved. I'm looking at my notes right now, again, by the lead of your business unit, and then also the chief administrative officer. So when they give us workflow timelines, we love those while we are talking about report writing and in our report writing training. The number that they give us is it will take about 45 days from when you get assigned a report until when, in best case scenario, if you don't even have to write it, it will be done. So I wanted to sort of make some of those clarifications of it's not just like a quick thing. I know that a couple steps after it was out of our control also fell behind because we're not the only people who touch it, and people in the organization are busy. But the good news is we're on the move. It went to Executive Standing Committee. Carla, Amy, and I sat there on Monday, and it passed. So, yeah, yes.
Thanks so much, Bailey. I appreciate that. Not just the outcome, but also explaining the process. I think that's very valuable for everyone on the committee to understand the constraints within which staff work. So thank you for that. I just wanted to ask if there are any questions on that item. And if so, if you can please raise your hand. No, okay. Again, thank you to staff. Thank you to Carla, Bailey, and others who were involved in that. Very grateful to you for making that happen. We're going to move on to 9.1.3, update on HRM training policies. You may recall this was a question that came up last time we got together, and we had kindly asked if Bailey could provide an update on this. And again, I'll just turn the floor over to Bailey, and then if there are any questions, we'll ask you to please raise your hand. Thank you.
All right. Hi again. So I know that there were questions about what mandatory courses existed for all employees for Halifax Regional Municipality for onboarding. And we went and found those. Those include access awareness, cybersecurity awareness, the HR policy bundle for things such as respectful workplace, code of conduct, etc., lockdown procedures, occupational health and safety, records and information management, and then the ones that will be more interesting to you all, is our values, so the core values of the organization training. And the one that my lovely office does is diversity and inclusion overview. All of those courses are mandatory for all employees. Not on that list, of course, is GBA Plus. I'm currently working on a timeline to sort of talk about how things have happened in the office and why the Women's Advisory Committee does advise on GBA Plus. Part of that is because until 2021, which is until about a year and a few months after the committee existed, we didn't have GBA Plus specifically for staff employees, so that we didn't have an easy way to get it out to staff in the same way, and we're still sort of working things out. So it's not that things have been like let to go wild, it's that things have come in a different order. So we needed in our terms of reference to give a lens from the Women's Advisory Committee, because we were adopting something new that hadn't been done before, at least within us. And we are currently still, like, within municipalities that have reached out to us, not as many municipalities go with GBA Plus as, let's say, like the federal government, which must do it. So it's not that work isn't being done and that we're just sending everyone to you to come and ask questions from scratch. It's that we're still working within the constraints that we have. And for our, oh, and the other portion of that is it's not that we don't promote the federal government one. We do a lot. Every time that we do GBA Plus for the municipality, every time that we have significant dates such as International Women's Day, anything gender related, really, we're pushing it again and saying, hey, remember, the federal training is there and you should be taking it. So it's not quite as simple as like nothing's really being done with it. All right.
Thanks very much for that, Bailey. And I think the question was, why is this not mandatory? That was kind of the main question that was posed. So thank you for explaining that process. So we've got a couple of hands up. I think you were first, Councillor Lovelace, and then we'll go over to Liz. Thanks.
Thank you. And I really appreciate this conversation because I raised this with staff recently. So as members of the Women's Advisory Committee in 2021, if there was any of you around the room at the time, you would know that Councillor Blackburn brought forward a motion from the advisory committee that specifically spoke to regional council members taking the GBA Plus training. Now, this is, I'm going to note this as a failure of our policy because that was 2021 July. We're now 3 years later in 2024. And this committee hasn't received any updates or response to the uptake as far as how many members of regional council took the training. Did regional council members have feedback on the training that the Women's Advisory Committee should consider? In addition to that, it just, to me, feels like we have this motion that went out, approved by this committee, approved by regional council, without any accountability or even transparency as far as who took the training. Because again, this was regional council telling its own members, hey, you need to take this training. Now, I know I took the training, and I'll guarantee you that not every regional councillor took the training based on the conversations that I've had with staff. And so I guess, Bailey, my question to you would be, number one, how do we make sure we can follow through from a project management approach to know that when this committee puts forward a motion to council that it's followed through on, and if it's not, then we should have a report back at this committee to make sure that we understand why wasn't it followed, what could we have done differently, what can we do to ensure it gets followed. But then more importantly, this should be in our list of achievements, right? This should be like in our annual review to say, hey, this was the motion that went forward, and this is the benefit that came from it. And at this point, I don't know, Bailey, if we even know how many members took that GBA Plus training, and whether or not regional councillors respected this motion that was at Women's Advisory, Executive Standing Committee, and regional council. So, yeah, I'll just leave it there.
Bailey, over to you.
Yeah, and I'm a bit out of my depth because this gets into a bit out of my wheelhouse of organizational organizational knowledge. Regarding holding council accountable, as staff, we have very limited power to do that.
Oh, I'm sorry. That wasn't my point. I'm sorry, Billy. Holding this committee accountable for knowing from the transparency and accountability perspective, we're the ones who put forward the motion. So I think this committee needs to understand how do we close the loop.
Oh, that is also out of my wheelhouse because I'm not in the clerk's office. Because I am still on the very corporate side so I'm not sure what the committee can do. That would probably be a conversation with the clerk's office to find that accountability. Beyond, I would know 2021 was before I was an intern at the time, so I wasn't in the position where I was doing training. So that would be beyond my knowledge. And yeah, sorry about that.
Okay. Totally unfair. And now I'm realizing, yes, you actually weren't engaged and involved, and many members of this committee were not either. And so I guess I'm going to throw it back to our chair to make sure that this is followed up through agenda review, and also the clerk's office can give us a better understanding. So I'd appreciate that, because I think we've discussed this at a previous meeting.
We have. Thank you for that, Councillor Lovelace. And it is a question that has been asked, and we will get an answer to that. So it will be in our minutes, and it will be as an action, and we will follow up on that. I don't know, Elizabeth, if you had anything you wanted to add to that before I go over to Liz.
I don't necessarily have a whole lot to add, just that I will follow up with you on this, Chair, and I'll look into this through the clerk's office in terms of how this can be how we can kind of close the loop on these types of things going forward.
And I understand that it's not mandatory, and we had that conversation and that reporting out from Bailey last time we got together. And so what we're really asking is how many of the regional councillors currently have actually taken it, and do they have any feedback? And I think the feedback piece is really important for this committee to understand what are people saying about whether or not that is meeting their information needs, and perhaps more importantly, providing a tool that they can bring to analyzing their policies and procedures before they actually go forward. And that was a question and issue that was raised previously. Is there sort of a post hoc consideration of SGBA after the fact, or should we actually be asking this question so we have a sense of how many people know that this should be done as part of the policy development process? Liz, thank you for your patience.
It's one of my many virtues. First of all, Bailey, are those new glasses? Because they look amazing. Have you had amazing glasses this whole time and I just never noticed? No, I'm just exposing my ignorance. I'm going to expose my ignorance even further now, actually, because the question I have is a real dumb question, and I hope you will all be patient with me, as you always are. But why do we do SGBA plus? Like, out of all of the many gender frameworks and matrices in the world, why have we picked the federal government's unbelievably detailed and bureaucratic framework? Like, why? Is it for funding reasons? Is it so like when we apply for federal grants, it's seamless because we've already done it? Like, is it a convention? I'm just dying to know the historical reason why we have chosen this magnificent made in Canada method.
And Liz, I get the sense Bailey is just ready to tell you exactly why.
Oh yeah, I'm just very excited that I know the answer to a question. So back in between the years of 2016 and 2018, Halifax Regional Municipality took place in a Federation of Canadian Municipalities program called Diverse Voices for Change. It was to raise participation of women in local leadership. We've just done a similar one. But from the initial Diverse Voices for Change project that HRM had taken part in, the women around the table, the women from supporting organizations, came up with a bunch of recommendations for how can the municipality be better. One of those recommendations was have a women's advisory committee of Halifax. And the other was, well, one of the others was Gender-Based Analysis Plus. It's a tool that they can use. So my the previous gender equity advisor was like, okay, we can use GBA Plus, but we're going to make one that's a bit more specific for municipal employees, so it's a bit easier for people to wrap their head around. But yeah, that is why we use GBA Plus, because the women in our community who took part in this fantastic initiative, the goal was to have a 1/3 participation of women on council by 2026. And then 2 years later, we had gender parity. How exciting. But yeah, it's because it came out of the recommendations of a project that had been done that led to things such as the Women's Advisory Committee and having various things.
God, I love Nova Scotia. So literally it's because somebody said, hey, you guys should probably do some kind of gender analysis framework training. Hey, I know of one. And then we all said, okay, great. That's one. Terrific. Okay. I just want to put a bug in everyone's ear just to say, maybe if we try and find out how many counselors have done it, and it turns out not a lot of them have done it, maybe one of the things that might be worth investigating is whether, because like I've done it like a million times, and it's not like, it's a lot. So maybe, and it's really designed, like it's designed for policymakers, but it's not designed for politicians. It's designed for bureaucrats. So there's a lot in it that's really sort of nitty gritty. Okay, here's how you build your program. Okay, like here's how you do your outcomes measurement. And that stuff's not really relevant to counselors. Like, you know, politicians are idea people. And then they have their great ideas, and then the rest of us are just like, boom, boom. Yes, exactly, Rhiannon. That's exactly it. It's like really, it's designed for funding applications to prove that you're making good use of public funds and that you have your evaluation programs in place and that you're building all of this. And I feel a bit worried that it's possible that our counselors who have so many demands on their time just might have had that horrible feeling that we've all had sometimes. No, you didn't take that. There's like a different one. There's a whole new SGBA Plus.
So can I, just for the sake of time and to keep ourselves organized, can I suggest that we put the question forward again, which is how many regional council members have taken some form, let's just say some form, of gender-based analysis training? Okay, so if they've done the federal government one, they get a gold star. If they did the one that Councillor Lovelace did, they get a gold star. We're just trying to determine what the threshold is, and then we can revisit this question about, you know, what's the most appropriate tool to be used in this particular context. So I hear the concerns about the applicability of the federal government GBA Plus for counselors and for the work that folks do in the municipality. So let's put a pin in that if we can, and we'll have that noted in the minutes. And we will come back next time with a follow-up on that question with some numbers. So we're going to have to lean in on the staff to do some sleuthing to find that out so we can get a sense of it. So Bailey and Elizabeth and others, I'm going to leave that with you. Happy to touch base with you between now and our next meeting to see how that's going. But that's the question that's being put forward again. So can we just put a pin in that for now? Everybody,
you're right. I shouldn't start solutioning until we know what the problem is. You're right.
Yeah, so let's put a pin in it for now. The question is any GBA training. That's what we're looking for, and so let's revisit that when we come back next time. And I'm going to move us along for the sake of time. It's 6:15 right now. There are no added items. That is correct, Elizabeth. I'm looking at you, and
yep, that is correct.
So we are going to move on to item number 11, which is the date of our next meetings. Those are September and October, and Elizabeth is going to regale us with the exact dates.
Yes, so the next meeting, it was not included on the agenda since it was still in the process of being rescheduled. The next meeting is September the 19th, which is a Thursday, and that will be at 4:30 as well. So that was initially the September meeting was scheduled for next week, September the 5th.
And the October meeting?
The October is October the 17th, and everyone will, once it is officially rescheduled, everyone will get a new, or I guess a revised calendar invite, so it can be added to everyone's calendars.
Thank you so much for that. That was a lot of work, Elizabeth. So thank you for continuing to get us to the point where we've got our September and October meetings sorted. Liz, was that a hand?
It was a whole body reaction. But I do have a question, which is, are we moving on a go forward basis to the third Thursday of the month now?
We are trying to figure out best availability to get quorum. So Elizabeth has spent a lot of time trying to figure out how to get us together and to get quorum. So this has been a lot of back and forth, as you all know. So I would say that's not necessarily the case, Liz. It's about, can we get quorum? And I see, Hannah, you've got your hand up. Please go ahead.
What happened to the suggestion of skipping one of the months to get us back on track to the first Thursday of the month? Because right now we're at the end of August, right? Our September meeting was supposed to be next month. If we skipped September and just went for the first week of October, we're only adding one extra week of missed meetings. Of like, we're doing a 5-week span instead of a typical 4-week span, but it would get us back on track for the rest of the year.
Right, and there was also an idea put forward to skip a meeting, and we had a discussion about that at our agenda setting meeting. I don't know, Elizabeth, if you have anything else you wanted to say on that item?
I don't have a whole lot more to add, just that that was something that the chair and you and I and other staff, we kind of discussed what we thought the best thing would be at the agenda review meeting, and the ultimate direction that I got was to poll members for those two dates, September and October.
Could we please consider picking a regular date going forward? Just because I currently have the first Thursday of every month booked in my work calendar on a go forward basis, which allows me to be present, which allows us to make my contribution toward quorum. I think if we're worried about quorum, if the first Thursday of the month is likely to be a problem for a large number of committee members, maybe it makes sense to pick another like go forward date. But part of being able to schedule it is knowing in advance when it's going to come. So I think we're working toward that goal if we pick a go forward.
Yeah, for sure. We have tried to pick a date that works for the majority. It's not just us, it's also staff. So, and speakers. So when we invite speakers, it has to fit with their schedule. So you can appreciate there's a lot of moving parts beyond just quorum. And so that was part of the logic of picking those dates. So it's September the 19th at 4:30 and October the 17th at 4:30. When it comes to November and December, we'll take your suggestions into consideration, and happy to sort of figure out whether we can make that happen, Liz, and that will be coming out to you shortly. I'm sure Elizabeth will be polling people for the other meetings. Elizabeth, over to you, please.
I just wanted to add just some additional clarification. As it stands right now, we're still going by the schedule that was approved for November and December, which is that there was no meeting scheduled in November due to the municipal election, and the December meeting was scheduled for December the 5th, 2024. So the December meeting is still scheduled for December the 5th, unless I receive direction to poll members for an alternative date.
So Liz, I'm assuming you have the December, Liz and others, you have the December 5th in your book, okay? And I guess one of the questions is in person for the December meeting or virtual?
I'm hearing Christmas party.
Okay.
Let's go in person.
All right, so we're gonna do December the 5th, 4:30 in person. And September and October 4:30 will be online. I hope everybody's happy with that. And I, again, appreciate staff's time in chasing people up, both presenters as well as members of the committee, to make those dates and times work for everyone, or for the majority of us. Elizabeth, anything else before we wrap up?
I just want to say that I may not be at any more meetings because I'm on the hustings and as we head into election. But I'll be thinking of you, and if I can't drop in, I will absolutely drop in. If there's anything that you need for me, certainly let me know. I'll continue to push to get accuracy on the plus numbers in response to that motion from this committee. And I really, really appreciate it. Okay, yeah, I'll come to the Christmas party. Gotcha.
All right.
And
thank you, Councillor Lovelace.
Just want to say thank you so much.
Thank you. Appreciate that. All right, everyone, could we please have a motion to adjourn? Rihanna, you were first up, so thank you for that. Thanks, everybody, for your time. I appreciate your sage advice and your input. Thank you, everybody. Take care, and we'll see you again soon. Thank you.
Thank you.
Take care, everybody. Bye.